Coronavirus vaccine eligibility. It's now expanded, open to every adult in Florida, and 16 and 17-year-olds also able to get the Pfizer vaccine. With this expansion, Spectrum News 13's Greg Angel goes in depth, sitting down with a medical expert on what life might be like once you get vaccinated.
Joining me today, Dr. Timothy Lair, Chief Medical Officer with Health First Medical Group. Certainly appreciate you being here. It's interesting seeing the observations. A lot of people feel like we're making progress. And I want to start with the pandemic itself, the bird's eye view. What are you sensing as far as the state of the pandemic, where we're at right now?
Well, in Central Florida, it appears we're doing better than we have been. Things are generally trending downward, although there is a fear that another peak is going to start to emerge. But right now, there's a lot of hope.
What's interesting, having conversations with county leaders, city leaders, folks at the convention center and elsewhere, there's so much relying on the vaccine itself. So many people saying we will get over the hill once the vaccine is really distributed in mass. What do you see? What is going to be the impact of the mass vaccination?
Well, that is the best way one gets over a viral public health emergency. You know, for bacteria, we have antibiotics, and we can kill bacteria. We can't kill viruses. The only way to deal with viruses is to prevent them. And so that's why before the vaccine, there was such a push on staying away from crowds, keeping your distance, wearing your mask, because that's all we had. Now we have much better, more complete ways of preventing viral infection without all those kind of uncomfortable social constructs. And so it's such a relief when our patients get the vaccines. They still, when they are near people who are unvaccinated, of course, they still need to keep the masks and the distancing and that sort of thing. But amongst their families who are vaccinated or their friends who are vaccinated, the masks come off. They can get back to the grandparent-child hugs, that sort of thing that we've all been missing over the last year.
Do you mind? Let's kind of hammer down on that point. Just make sure. We're really talking in depth here. Once folks get vaccinated, again, it's going to take a little bit of time before the majority of the American population is vaccinated. But what do people need to keep in mind? Can they get vaccinated today and immediately, rip off the mask, or does it depend on where they're at? Talk with us a little bit more in depth about those points, since we are kind of entering this vaccination process period.
Absolutely, Greg. So right now, there's the two vaccines who we've had for a little while, the Pfizer and the Moderna. They're both two-stage vaccines. You get one dose, and then you get another dose 3 to 4 weeks later, depending on the vaccine. 2 weeks after the second dose, you're considered fully vaccinated. For the Johnson & Johnson vaccine, which isn't quite as plentiful yet, it's a one-dose vaccine. 2 weeks after you receive that one dose, you're considered fully vaccinated. Once you're fully vaccinated, you can meet indoors with other people who are fully vaccinated. No need for masking, no need for social distancing. You're all fully vaccinated, and the risk is incredibly low that anybody would have illness. These vaccines are much more effective than we had even planned. Now, the CDC has also said you can even unmask and interact with people who are all from a single household, as long as there's no real high-risk folks in that household. So that's just, it kind of frees you up to do so many of the social things we've all been missing. And it's going to be good for the economy as people get out and about once more people are vaccinated.
Well, you talk about the economy, and the one thing here in Central Florida, our economy is anchored by tourism. And so we have millions of people coming from all different parts of the world, typically, and the country. And as you know, different parts of the country, geography, weather, things like that kind of impact people's behavior and thus, the virus in itself. I'm curious what the health experts are saying as far as the vaccine. Is this the one and done kind of deal, or is there a reason we need to watch, say, the fall to see how things develop as we're talking about kind of these other variants of COVID-19 and things like that? Is this the one and done, let's celebrate once you get the vaccine, or are there things that we need to be cautious about and still look ahead to?
Well, there is a lot of celebration going on for those who have been able to get the vaccine, and of course, that effort's been stepped up quite a bit in the last few weeks here in Central Florida. Now, as far as the one and done, the public health experts do have their eye on these variants. They are very concerning. It's unclear right now whether new booster doses or such will be needed if those vaccines take more of a hold. Right now, the current vaccines appear to be holding their own against those vaccines, or against those variants, pardon me. But so stay tuned. We're not 100% sure how this pandemic with the variants is going to progress. But right now, the vaccines are our best hope. And they're performing very admirably. The incidence of people ending up in the hospital with severe illness after having been fully vaccinated is close to zero. So I would encourage all of our viewers to get vaccinated. I've been vaccinated. All the doctors I work with have been vaccinated. It's really an easy thing we can do for our loved ones in the community.
Well, certainly a lot of people are ready to just be beyond this, maybe even already talking about 2022 to kind of move on there. Dr. Timothy Lair, Chief Medical Officer with Health First Medical Group, we really appreciate you joining us and going in depth with us. Thank you very much.
You're welcome, Greg.